Hey, have you ever found yourself wondering about the tricky ways medications can mess with your blood sugar levels? Especially when you're tackling diabetes? It's like trying to navigate a maze, isn't it? You take one medication to keep your blood sugar in check, but then bam! Another one comes along and throws everything off balance. Well, let's uncover 10 medications that might just surprise you with their impact on your blood sugar levels in a bad way. High blood sugar is no joke. Think of it as a sneaky troublemaker quietly causing damage behind the scenes. So, what are the risks? First off, high blood sugar can take a toll on your heart. It's like putting your ticker through an intense workout without a cool down. Over time, this can lead to heart disease, stroke, and all sorts of cardiovascular complications. But wait, there's more. High blood sugar doesn't just stop at your heart. It can mess with your blood vessels too. It's like throwing a wrench into the gears of your circulation system, causing damage to your arteries and increasing your risk of developing conditions like peripheral artery disease. So, yeah, the risks of high blood sugar are no joke. It's like a ticking time bomb just waiting to explode if you don't keep it in check. Let's take a look at 10 medications that can raise your blood sugar. Starting off with number 1, corticosteroids. You know those corticosteroid stocks often given for asthma, arthritis, and skin issues? Well, turns out they're not just sweet relief. They can mess with your blood sugar too. They're all about tamping down inflammation, which can be great, but they also crank up glucose production in your liver, sending those sugar levels sky high. Dosages vary depending on what you're treating, so stick to what your doc says and keep an eye on those sugar levels. Oh, and watch out for side effects like weight gain, high blood pressure, and a higher risk of infection. It's all about finding the balance, right? Number 2, beta blockers. So let's talk about beta blockers. These meds are pretty handy for dealing with stuff like high blood pressure, heart failure, and migraines. They do a good job at keeping those conditions in check. But here's the catch. They can mess with your insulin sensitivity, which means your blood sugar levels might creep up a bit. As for how much you should take, well, it depends on what you're dealing with and which specific beta blocker you're prescribed. Just make sure you stick to your doc's instructions and keep an eye on your sugar levels. Watch out for side effects like feeling tired, getting dizzy, or having cold hands and feet. Number 3, antipsychotic medications. Antipsychotic medications are prescribed to treat mental health disorders such as schizophrenia and bipolar disorder. Unfortunately, some of these medications can cause significant weight gain and increase the risk of developing diabetes. Normal dosages vary depending on the specific medication and the severity of the condition. It's essential to follow the prescribed dosage and attend regular checkups to monitor blood sugar levels. Side effects may include drowsiness, dizziness, and increased appetite. Number 4, diuretics, aka water pills. They're often prescribed to tackle things like high blood pressure and swelling. Pretty handy, right? But here's the thing. Some diuretics can mess with your blood sugar levels by making your body more resistant to insulin. The dosage? Well, it depends on the type of diuretic and how bad your condition is. Watch out for side effects like peeing a lot, messed up electrolytes, and crampy muscles. Just a heads up. Number 5, statins. So you know about statins, right? They're those meds your doc might give you to bring down your cholesterol and keep your heart healthy. Generally, they're pretty well tolerated, but here's the catch. Some types have been linked to a higher risk of diabetes. Dose-wise, it really depends on which one you're taking and your own cholesterol levels. Make sure to stick to your prescribed dose and don't skip those regular checkups to keep an eye on your blood sugar levels. Oh, and watch out for side effects like muscle pain, liver stuff, and tummy troubles. Number 6, antidepressants. Antidepressants are commonly prescribed to treat depression and anxiety disorders. While they can be beneficial for mental health, some antidepressants, particularly certain classes like tricyclic antidepressants and selective serotonin reuptake inhibitors or SSRIs, have been linked to weight gain and increased blood sugar levels. Normal adult dosages vary depending on the medication and the severity of the condition. It's crucial to follow the prescribed dosage and attend regular follow-ups with your healthcare provider. Side effects may include drowsiness, nausea, and sexual dysfunction. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 7. Anti-seizure medications. Anti-seizures medications are prescribed to manage conditions like epilepsy and neuropathic pain. While they're effective in controlling seizures, some of these medications can also raise blood sugar levels. Normal adult dosages depend on the specific medication and the individual's medical history. It's important to take anti-seizure medications as directed and monitor blood sugar levels regularly. Side effects may include dizziness, drowsiness, and difficulty concentrating. Number 8. Glucocorticoids. Glucocorticoids, similar to corticosteroids, are prescribed to reduce inflammation and suppress the immune system. They are often used to treat conditions such as rheumatoid arthritis and inflammatory bowel disease. However, like corticosteroids, glucocorticoids can also increase blood sugar levels by promoting glucose production in the liver. Normal adult dosages vary depending on the medication and the severity of the condition. It's essential to follow the prescribed dosage and monitor blood sugar levels regularly. Side effects may include weight gain, mood changes, and increased appetite. Number 9. Hormonal contraceptives. Hormonal contraceptives like the pill, patches, and injections are pretty popular when it comes to preventing pregnancy. They're usually safe and get the job done, but here's the catch. Some of them can mess with your blood sugar levels, especially if you've got a risk for diabetes lurking in your medical history. Now, when it comes to how much you should take, it all depends on which type of contraceptive you're using and what's going on with your body. So make sure to have a chat with your dog about what's best for you. Oh, and let's not forget about the not-so-fun stuff, side effects. Nausea, headaches, and changes in your period flow might pop up. So it's good to keep an eye out for those. Bottom line, when it comes to hormonal contraceptives, it's all about weighing the pros and cons with your healthcare provider to find what works best for you. Your health and happiness matter. Number 10. Nicotine replacement therapy. Alright, let's talk about nicotine replacement therapy. Like those nicotine patches and gum you've probably seen around. People often use these to kick the smoking habit, and they can be a real lifesaver for quitting. But here's the thing. Nicotine itself can mess with your blood sugar levels by making your body more resistant to insulin. Now, when it comes to how much to use, it really depends on what kind of nicotine replacement product you're using and how much do you smoke before. It's super important to stick to the recommended dose and make sure you're using it as part of a bigger plan to quit smoking. Just a heads up though, some folks might experience things like skin irritation, feeling dizzy, or even some tummy troubles. So if you're trying to quit and using these products, keep an eye out for any of these side effects, alright? Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!